worker is a massive help to us. We can't win this battle on our own. We need our seniors. We need consultants behind us. Dr. Rob Galloway, A&E consultant.
Rosanna, I'll take on Mr. Hunt with you. Consultants and juniors together. Thank you for coming to support the junior doctors and the NHS. On the 5th of July 1948, in times of deep austerity, the NHS was born. Opening it, Nye Bevan said, the NHS will last as long as there are the folk with a faith to fight for it. But now the NHS is at a knife edge. Ask any of us who work in the NHS and we'll tell you the patient care is deteriorating and staff morale is plummeting. The NHS winter crisis is now year-long, and it could get so much worse by the imposition of a junior doctor contract which is unfair and unsafe. Patient safety and the viability of the NHS is at risk. And yet the government hide their head in the sand and say all is fine. But the reality is so different to what they say. The NHS, which the British public care so passionately about, may soon not be able to care for them. But do not give up hope. Remember what Bevan said. The NHS can survive because we are the folk. We have the faith. And we will fight! I pay tribute to the organisers, especially my registrar Selwa, but also Anna, Roshana, Sandeep, Hannah, Yizan and Morley. I'm so impressed. And I thank you all for coming. Thank you to the juniors here, but remember, junior only in name. And thank you to the juniors who couldn't come because they're working. If it were not for the fact that so many of our staff would be working, this demo would be twice as big. And thank you to David and all the other healthcare workers who are supporting us. And also thank you to our patients, because they'll be the ones most affected. So why am I speaking today? As a consultant, I am proud of the amazing work our junior doctors do. And I support their right to be treated professionally and fairly, that which is all they want. For me, the risks to the NHS of saying nothing are now greater than any personal risk of speaking out. But the main reason I'm speaking is because I am scared. I'm scared for the future of the NHS and scared what will happen to our patients. No one disputes we need a new contract. It needs reform, but it needs to be fair and it needs to be safe. I heard Mr. Hunt on the radio this morning. Let's put some myths to bed. Jeremy Hunt says that we need a new contract to improve care at the weekends. But with the existing contract, you can provide good care at the weekends. For example, in A&E, our juniors work about 1 in 2 weekends. He is not interested in improving weekend cover. He is interested in not paying for that cover. How is it that working at 10 p.m. on a Saturday is the same as working at 2 p.m. on a Tuesday? I don't see the lights of the House of Parliament on 10 p.m. on a Saturday, do you? With no difference in pay or extra time in lieu for this, people will be put off for going to a specialty like mine, like A&E. As it stands, the new contract would harm patient care, not help. No one objects to working outside 9 to 5. They just do not want a pay cut for it. Myth number 2. Mr. Hunt says 3 things. 1, the junior doctor's salary bill will not change. 2, we will pay people more to go into difficult specialties like mine in A&E. And 3, no one will have their pay cut. The 3 don't add up! One of these cannot be true! You cannot trust the man! How is it right that we have a contract which will financially penalise people doing research? How is it right that we can have a contract which removes the safeguards on junior doctor hours? How is it right? How is it right that in the last 5 years all NHS workers have had relative pay cuts and MPs have had 10% pay rises in the last year alone? David Cameron said, we are all in this together. Laughable. But it's not just us or the BMA saying this, it's the government's own MPs, such as Dr. Sarah Wollaston and Dan Poulter. But then Jeremy Hunt has the nerve to say to you that you don't understand the situation and everything is okay. But there is a problem. He is discredited. No one trusts him. As Dan Poulter and Minister for Health until a few months ago said recently, the junior doctor contract that has emerged over the summer is very different from the one being discussed this time last year. Then there were no talk of 90-hour weeks, no talk of large number of junior doctors having their pay cuts. Jeremy Hunt, you have become the best recruiter for the Australian Health Service. He is the Volkswagen. He is the Volkswagen of politicians. He sounds good. He looks good, but you cannot trust his ambitions. The government are bullying NHS workers, and you know what you need to do to bullies? You need to stand up to them. We have to stop this. I say to the government, no preconditions at all. Go back to the negotiating room and actually negotiate and come up with a safe and fair contract. And then we can stop a strike. But the issue is larger than just about junior doctors. Much, much larger. It is about the future of our NHS. I work on the coalface at the point of need from the faces. I work on the coalface and see how the problems, but also how wonderful it can be. Paid for by taxes and free at the point of need from cradle to grave. Sorry, I didn't expect this. I'm trying to do a speech. I'm sorry.
Get in the NHS selfie.
Right. When I see a patient in A&E, I think of airway breathing circulation and not airway breathing credit card. Till recently, the NHS was run allowed to make its clinical care a priority and not shareholder greed. The NHS was not just a kite mark, but an ethos of how we care for people. Cooperation and not competition. Patients before profits. But in America, where healthcare is run by the free market, they spend double what we do, and they get much worse care. But things are changing, especially since the reforms the last few years. But one of the things I agree with is the introduction of a mandate of a duty of candour. Be honest and apologise when things go wrong. Jeremy Hunt and David Cameron, I want you to start following that duty of candour. When you came to power in 2010, you said there'd be no top-down reforms and privatisation. But that wasn't the truth, was it? We warned you of the risk and you ignored us. 33% of new contracts come to the private sector, and with wasted billions in new management structures. As we've seen recently, hospitals are being destabilised. You need to apologise. You said the NHS should be safe in your hands, but we've seen existing staff leaving their droves, waiting lists up, cancer target missed, satisfaction down, and the return of corridor medicine in A&E. You need to apologise. You said you'd fund the NHS, but we've seen a dramatic funding cut per patient. We see cuts to social services. It's having a dramatic effect on NHS. You need to apologise for that. You break patient confidentiality with a political stunt for a tweet and show no remorse. If I did that, I'd lose my job. You should at least resign. You promised to treat staff well, but you don't. You said as a consultant, I don't work weekends. I'm not professional and I should get real. Well, 2 weekends ago I worked. Last weekend ago I worked. And do you know what I'm doing tomorrow night? I'm at work, Jeremy. You have insulted me and my colleagues. You need to apologise. You have misrepresented, distorted the truth and politicised the NHS. You have angered so many of us with your attitude and arrogance that sensible discussion on need for reform is increasingly hard. But worst of all, you've manipulated the press and made people frightened to seek help at the weekend. You've even got yourself into the medical textbooks with a condition named after you, the Hunt effect. Delayed presentations, it's not funny, delayed presentations and worsening outcomes because of political gimmicks. You need to apologise. I hear people say you should resign. If we shout loud enough, he might hear us. Hang on, shush. He should hear us. It's a Saturday, that's working time, isn't it? The whole management of the NHS has been absolute omni-shambles. All this was happening. Cameron sits there with his head in his sand, not seeming interested and saying things are fine. When it comes to the NHS, he is the whatever Prime Minister. That is not good enough because lives are at risk. But I'm scared. I'm not sure if this is all incompetence or a political attack for political ideology. I want to go back to our junior doctors and medical students. I want you to join the BMA, so you have a voice, and please don't leave the NHS. We need you. When the spin and deceits are replaced by truth, the government will be forced to change track. It'll be a hard battle to win, but we must win. As a society, we're at a crossroads. We have to decide what we want. Is it right that we have cuts to the NHS while the richest 1% in society gets cuts to their tax bill? Do we value and reward the bankers and speculators who cripple the country, or do we value and reward the doctors and nurses who heal the country? We need to go out and reclaim our NHS from the politicians and profiteers in order to save our NHS. And we start the fight back for the NHS with a fair and safe contract for our junior doctors. Just remember what Nye Bevan said. The NHS will last as long as there are folk left with a faith to fight for it. We are the folk. We have the faith. And we will fight for it. NHS, NHS, NHS.